So I'll move on with the next portion of our discussion, and we're going to be talking about changing gears a little bit and switching things, and we're going to be talking about a different area, as one referred to as patient advocacy. Now, to help try to familiarize things, I'm going to attempt, this may not be easy, I'm going to attempt to help describe advocacy because it can happen in so many different ways, shapes, and sizes, especially when it comes to metastatic breast cancer. And I think that I'll start off by giving an example of what physicians, doctors do routinely and can do sometimes additionally to help advocate, for their metastatic breast cancer patients. And so doctors, we have our organizations, and these organizations are known as advocacy organizations, and they can help be our voice. They can be our voice at the legislative levels where rules and regulations are made. For example, doctors belong to and support, the American Cancer Society. Anybody can belong and support the American Cancer Society, and also the American Society of Clinical Oncology, which are two organizations that try to make sure, through the legal mechanisms, that there is funding available for cancer research, for grants. You also have other types of organizations, such as Community Oncology Alliance, which is not that well known among the patient level. And this is an organization whose main focus, and they're advocates for cancer patients, is to make sure that patients have access to affordable care close to home. And just to give you an example of what this organization does, I'm involved with them at a national level, but last year they helped overturn some policies that were being developed by the Center for Medicare and Medicaid Services that would have turned all Medicare cancer care into a national mandatory experiment. And 3/4 of the patients that receive Medicare health care, they would have been, if they're getting active chemotherapy, 3/4 of them would have been randomized to some form of experimental arm and could have been at risk for not getting access to very unique life-saving drugs. Well, you hear about things like that. Yes, it's being done in an attempt to help try to reduce the cost of some of these medications, to curb the doctors from writing for expensive medications. Well, we can't help it. Some of the latest and greatest and best medications, they are going to be more expensive, and there is no unique alternative. And so we saw and realized that this probably was not going to be a very good idea at all for our cancer patients. So we networked together nationally with many, many, many other organizations, and we motivated and mobilized many of our patients and had them contact their local representatives, their congressional representatives, their national congressional representatives, and their senators to let them know that they can't support this, they got to stop this. And so we have to advocate on a national policy level because all of the health care that we are able to get is developed by people who develop policies. And they may or may not understand how their policies, even though they work for 80% of the public, it may adversely impact our cancer patients because it's such a unique condition. And hey, if you have a HER2 positive metastatic breast cancer, you don't have a lot of options at times. Or if you have a triple negative breast cancer, in some unique situations, you may have a very good option now, but it's expensive. What happens if you can't get that? Well, then you're left with other treatments that may not be as effective or may be more toxic. So cancer patients are a unique population. Also, the other things that physicians do on a day-to-day basis, we spend a lot of time fighting with insurance companies, just getting authorizations for basic things, just for a basic scan, so you can see where the disease is. They'll say, oh no, we don't think this needs to be done. But it does, it takes time to be able to do this. And sometimes even though we have patients in the waiting room, we are expected to be on hold for 15 minutes to wait for someone. Even though we have a scheduled appointment at 1 p.m., they keep us on hold for 15 minutes hoping we'll get frustrated and hang up. So we can't have a chance to fight for our patients. So they do this routinely. It's for them to control costs. They think, well, if the patient really needs it, do it. The doctor is going to fight for it. Yeah, we end up having to do it, but that takes a lot of time. So we're advocating with you, for you to make sure that you get your care. And the same thing comes with medications. Sometimes the payers want you to have failed certain medications first. Medications that may not be right for you, or medications that you may have already had. But still, their policy, and their policy is being regurgitated to the doctor by someone that doesn't even have a medical background. So, oh, you have to have failed products A and B first before you can get that one. Well, sometimes we have to sit there and argue with them. We have to demand to talk with a medical professional, try to talk common sense into them sometimes so that our patients can get the right medications. We will often at times, as was mentioned by our panelists, we will have to confer with other doctors. So we will even meet to discuss cases outside of the clinic at these events that we call tumor boards, where we can present the case, discuss this with other colleagues. I'm very fortunate that not only can I do this in the hospital where I work, but my practice, which happens to have over 200 physicians, I can put a case out to them and we can look at it all at the same time virtually over the internet. So I can get input from 200 other medical professionals about my cancer patient and maybe potentially their unique case. So that can be helpful at times. Also, advocacy can take place in other forms. Not only does a physician have to be an advocate and can only be an advocate, obviously the most influential advocate is the patient itself. I've gone to the Hill in DC on several times and had with me cancer patients. The elected officials really listen to your stories much more than they will listen to an oncologist. When they hear what you've experienced, when they hear the troubles you have had with the system and how it may be set up now, that helps to motivate them to realize they need to take the time to fix a broken system. Now, I'm not necessarily picking at our medical system. Yes, we do have one of the best in the world. It is perhaps the most complicated in the world too at times. And sometimes it can just be very difficult for patients to get the right care that they need. And our elected officials need to hear about this. So patients, you yourself or your family members can be very strong political advocates. And especially this time of year where we're at, the Florida legislature is meeting. You've got lots of things going on with healthcare reform on a national level. It's going to behoove everybody to try to stay on top of these changes that can happen that may affect your care. And we find that one of the best ways to do that is to get that information from your doctor's office. For example, my practice, we go out of our way. A big event comes along, or something like this experiment that I previously told you about happens. We make sure we develop the information, the educational information, to make sure our patients are aware of it. You've got to be informed. You're not going to hear about this stuff on the news until it's too late. So if you're relying on the news, you're going to be 20 steps behind. You will not be ahead of the game. Other things that patients can do and their caregivers is what you're doing here today. Do not take that for granted. Yes, everybody's busy. Yes, people don't have a lot of free time. But you're taking the time to sit there and join us with this event, to listen, to understand, and so you can hear and understand more about what the patients are going through and what it takes behind the scenes on a global level to try to get the care that you need so that you can have good treatment and a good quality of life.